Thank you for bearing with me a second time. I was asked to talk about alternative medicine facts and fallacies, which is a nice subject because on my blog I'm doing mostly that sort of thing. In a way, it's a little bit like a session at the dentist. I will explain that to you. Fallacies are like false teeth in your brain, so to speak. And I'm going to pull a few of those teeth, so it might be a painful session for some of us. The definition of a fallacy is a misleading argument, a misconception of falsehood. The opposite is a fact or reality. And the thing is that they look plausible, the fallacies. They are commonly believed, and unfortunately, they're neither true nor logical. Alternative medicine is riddled, I can promise you that, with fallacies. And yesterday I was told that I have a little bit more time, so I spent half my night redesigning my talk. Also redesigning my talk according to what I heard in the plenary sessions yesterday. So you will recognize some of the themes that have been mentioned before. The first tooth I'm going to pull is a wisdom tooth with 3 roots. Appeal to popularity, appeal to authority, appeal to celebrity. The logic here, or the pseudo-logic goes, a large percentage of the population is using alternative medicine. By the way, you can substitute alternative medicine by complementary medicine or integrative medicine if you want to. I don't care very much about these umbrella terms, as I said yesterday. Many famous people support alternative medicine. That is certainly true. In Britain, this is Prince Charles, of course, who is a staunch proponent of homeopathy and other nonsense. And the argument goes, many people use alternative medicine. Most of them are satisfied with it, otherwise they wouldn't use it, and some even pay out of their own pocket for it. And that, of course, is true. It's not a fallacy. It's a truth. The fallacy comes when we draw the conclusion of that. Alternative medicine is popular, therefore it must be a good thing. And if it's a good thing, it must be available to everybody, and it must be free of charge. This is precisely what Prince Charles is going on about. For instance, I'm sure in France you have different characters arguing the same sort of thing. But the truth is that all therapies that are reimbursed by the public purse must be evidence-based. That is what I certainly do believe, and I'm not the only one, luckily. So the question arises, which alternative medicines generate more good than harm in comparison to conventional treatments for the same condition? Here's my full list. After 25 years of research, I have found arguably one, and I hesitate to put that there, but I feel very generous today, so I felt I had to put one there that does generate more good than harm than a conventional therapy for the same condition. It's St. John's wort. It's a herbal remedy for mild to moderate depression. There are about 40 decent quality trials to show that it is at least as effective as conventional antidepressants. And why is it better in terms of risk-benefit profile? Because it has far less side effects if used properly. So that is the very sobering fact about the risk-benefit, the relative risk-benefit. Second fallacy. It worked for me, my child, my cat, my aunt, my grandma, whatever. Scientists can say what they want, but I have personally experienced benefit from this or that alternative treatments, and I don't need scientists to tell me what works. And indeed, dozens of observational studies show the same phenomenon. About 70% of patients experience benefit after homeopathy, for instance, or any other alternative treatment. Yet, if we then do rigorous trials or systematic reviews of rigorous trials, we find that this conclusion is not confirmed by the science. How can that be? How can there be such an overt contradiction between the experience and the evidence? The answer is there is no contradiction. The clinical outcome determined that determines the experience has so many facets other than the effectiveness of that therapy. And patients will experience improvement even after ineffective or mildly harmful treatments. The reason is that experience is based on perceived therapeutic effects. And this is a colorful camembert. And you can see that the specific effect of the treatment here symbolized in black. If you take that out, you still have a sizable camembert. You still have a good experience due to the placebo effect, to clinician-patient interaction, to the natural history of the condition, regression towards the mean, social desirability, concomitant therapies that might be used, and probably several other effects that I haven't put on that slide. So the improvement after an intervention is not the same as the improvement because of the intervention. That is pretty obvious to me, but not all that obvious to many people in alternative medicine. And the plural of anecdote is not evidence, but anecdotes. In other words, we need science. Science is probably the only way to stop you fooling yourself and fooling your patients. The third fallacy, placebo helps patients. That's not a fallacy, it's the truth. Of course, very few people would doubt that. Placebo effects can be beneficial. It's the argument again that follows from that. Placebo effects help patients and therefore can they be used in routine healthcare? That is the question. Is it okay to use homeopathy, spiritual healing, Bach flower remedies, or other disproven therapies because some people perceive benefit from it via the placebo effect? The clinician's answer often is yes. All that matters to the clinician could be that if it helps the patient, that is fine by me. And that came across yesterday quite strongly in some of the sessions. But it's much more complex than that. There are several negative answers to that question. Placebo effects are notoriously unreliable. They are short-lived. They are not life-changing. You cannot save a person's life with a placebo effect. And the clinician really should argue that placebo effects are notoriously unreliable, short-lived. Some people respond. The patient who responds today might not respond tomorrow to a placebo effect. We don't know. We have not yet identified placebo responders versus non-responders. The second no is if we are content with achieving placebo responses, we won't make progress. We would still be living in the dark ages of medicine. That is the researchers' argument. Why would we try to improve on the placebo effect if we are content with it? The ethicist's argument would be placebo entails deception. If I, as I explained yesterday, if I tell my patient that he should take a homeopathic remedy which contains nothing and hasn't been shown to work, but he should nevertheless take it anyway, he wouldn't benefit from a placebo effect. I need to deceive the patient in order for him or her to benefit from the placebo. The clinician's argument would be that a placebo very often might replace an effective treatment. If I have a patient suffering from a treatable disease, by treatable I also mean symptomatically treatable disease, and I give that patient a simple placebo, I'm cheating that patient. Some placebos are not free of risk. I've shown you that yesterday, the risks associated with spinal manipulation, for instance. And placebos might promote irrationality. If you think of healing, for instance, there's a sort of divine or cosmic energy which a healer transfers into the body to make the body heal itself. That is, in my view, undermining irrationality. If you believe that a remedy like homeopathy, which contains nothing, can nevertheless be effective, that is undermining irrationality. It's undermining evidence-based medicine. It's undermining science-based medicine. And finally, and this is probably the most important argument, we don't need a placebo to convey or generate a placebo effect. If I use an effective treatment to treat my patient, and if I use that with kindness, empathy, compassion, I will generate a placebo effect also, plus the specific effect of the treatment, which means just giving the placebo is cheating the patient. Therefore, the score is clearly on the side of the nose. It's 1 to 7 if I count it correctly. And I would argue that the fact that an alternative treatment generates a placebo effect is no justification whatsoever in adopting it into routine healthcare. The fourth fallacy appealed to tradition. We've heard that yesterday. These treatments have stood the test of time. They're thousands of years old. Acupuncture is estimated to be 2,000 or 3,000 years old. Homeopathy, 200 years old. And these treatments wouldn't be around any longer if they didn't work. So that they have stood the test of time, and this test of time is so much more powerful than the test of science. Well, not everybody and not everything that has stood the test of time is agreeable or pleasant. And a long history might mean that the treatment has stood the test of time. More likely it means it comes from an era where our understanding of nature, physiology, etc. Was woefully incomplete. And therefore, it is not a bonus, a long history. It could be quite the opposite. Good example is bloodletting. It was used in most medical cultures. It has helped virtually no disease, very few diseases, are helped by bloodletting. And it must have killed millions. When about 200 years ago, the first person had the bright idea to test whether bloodletting worked, the first trials of bloodletting showed that it didn't work. At the time, it was interpreted as meaning that the clinical trial is no adequate method of testing interventions. Fifth fallacy, conspiracy. This was published in JAMA a little while ago, and it shows that a sizable proportion of the American population believes that the FDA is intentionally suppressing natural cures for cancer because of drug company pressure. That sort of fallacy we have abundantly in alternative medicine. It is usually the big pharma or the regulator or the scientific establishment or Edzard Ernst or the Ku Klux Klan who is the bad guy. And I mentioned the Ku Klux Klan for a reason, because this is Christian Boiron, who is the owner, or one of the owners of Boiron, the world's largest producer of homeopathic remedies here in France. And he said a couple of years back, there's a Ku Klux Klan against homeopathy. And I should mention that he has good reason to think we are the Ku Klux Klan, because he earns 600 million euros per year with his placebos. Number six fallacy, true believers are ethical. I picked that up yesterday in a talk where somebody explained that if a homeopath in his own belief systems is absolutely convinced that homeopathy is correct and works, then he prescribing homeopathy is ethical. If a homeopath, a healer, an acupuncturist, etc., believe in their theories, they behave ethically when they administer their treatments, even if these treatments are not evidence-based medicine. That is what I picked up in that lecture yesterday. And I show you here a trial which has nothing to do with that particular issue. Just to mention that for this trial we employed 5 homeopaths in Britain to administer the homeopathy for the asthmatic children. And the trial ran for about a year or so, and while the trial was running, one of the homeopaths developed a little brown spot on her lower arm, and even though she was in contact with doctors almost on a daily basis, didn't show it to them and treated it homeopathically. Before the trial was over, we had to look for a new homeopath because she was dead of a malignant melanoma. If homeopaths do that to themselves, I shudder to think what they do to their patients. I don't think that is ethical. True believers are ethical. This argument seems logical from some perspectives, but I disagree with it, because it disregards a higher ethical duty of the clinician, the duty to be well informed and competent. Somebody who mistreats people with homeopathy in this case is not competent and not well informed, I would argue. Conviction renders a quack more socially acceptable, but also more dangerous, because the quack becomes more believable and more convincing. Fallacy number 7, that's my last one. All alternative medicine is rubbish. My critical stance earned me this nice little picture in the Times. Out of the blue, I had no idea they were planning this. And I like the picture, and I'm obviously flattered to be depicted in the Times like this, but I'm not a bloody quackbuster. I'm just a scientist applying science to this weird and wonderful field of alternative medicine. And a skeptic, I'm a skeptic in the sense that I'm a person who questions the validity, authenticity, the truth of something purporting to be factual. And I believe that a non-skeptical scientist is a contradiction in terms. This sort of thing, being called a quackbuster just because I apply critical thinking to science, got on my nerves so much that one day I decided to publish this article, Complementary Medicine, what the NHS should be funding. And this is based on our research, and you can't read the table, therefore I have rewritten the table here. These were the treatments, that's over 10 years ago. These were the treatments that at the time were evidence-based according to our evaluations, and that's only the first part, that's the second part of the same table. So I doubt that many researchers in alternative medicine have actually proven so many alternative treatments. You see that most of these treatments are of a herbal nature. They're medicines that you take by mouth, and you recognize the St. John's wort, which is probably the best, and it's also the only one, as I already mentioned, that might be superior to conventional medicines in terms of risk-benefit profile. So a very, very short list indeed of those treatments. The end is near, and I'm leaving enough time for discussion by coming to my 5 conclusions. First, alternative medicine is full of fallacies. Fallacies are difficult to correct by definition. They can seriously mislead us, and therefore they are dangerous. I have shown you some of these dangers quite dramatically. And the best antidote against fallacies is to expose them for what they are. They are logical errors. Thank you very much.